non-surgical options. What are we talking about? Some are extremely simple, like modifying a person's lifestyle somewhat. An example of that would be if a patient is having a lot of difficulty with fairly aggressive activities such as running, where moving to a low impact or non-impact type of exercise such as biking or swimming might really make the difference and may get that patient to a point where they're comfortable enough with their joint that they don't feel they need an operation. Bringing down a patient's weight or certainly keeping in good shape is also very important, and physical therapy may be helpful. So I will tend to write a physical therapy prescription for almost everyone. A lot of times patients are able to do exercise on their own, and simple things such as yoga and stretching and walking can be adequate for some people. Simple medicine like ibuprofen and Aleve, which is anti-inflammatory medicine that's non-steroidal, and you can take right over the counter, sometimes can be very effective, and it's certainly reasonable to try that. Once that loses its efficacy to a certain degree, especially if a patient has a significant flare-up of pain in a knee or hip joint, we can try an injection. Typically, we start out with a steroid injection, such as cortisone. That's very common. I do anywhere from 5 to 10 of those a day, believe it or not, in my office. And then slightly less common, but still something that we might try, are what are called hyaluronic acid injections, which is sort of a cushioning type of injection of a synthetic substance that the natural substance of which we all have in our joint fluid, and the synthetic version is made, believe it or not, from chickens, and we inject that into knee joints quite frequently. It's not approved for hips, and its ability to help knee arthritis is somewhat in question, but it's something to talk about, certainly. Exercise and weight control are critical. It's been shown that exercise and keeping one's weight under control is some of the best ways to treat this kind of problem. Exercise will decrease pain and will improve someone's flexibility, and keeping to a healthy diet can certainly facilitate losing weight and keeping a person's weight under control, and then therefore putting less stress on your joints. We already mentioned some of the medicines. People also try Tylenol, and I highlighted narcotics here. Narcotics are highlighted because that's really not something that we would typically use to treat arthritic joints. I think if you get to a point where you're needing narcotic pain medicine to treat your pain, you really should seriously consider surgery at that stage. There are some effective topical pain relieving creams and sprays, such as something known as Voltaren gel. And I've heard patients even say that some of the CBD creams can be very effective, and I think that's reasonable.